Since its independence 69 years ago, Pakistan continues to face challenges in facilitating primary health care infrastructure within the rural areas of the country. Coupled with security issues, continual natural disasters in recent decades, and a disjointed health care policy between the federal and provincial governments, the country lags behind the majority of Millennial Development Goals set by the UN as a benchmark of development. The country has to contend with its suboptimal healthcare indicators related to higher maternal mortality rates, infant mortality rates, under 5 child mortality rates, and a high burden of communicable diseases such as tuberculosis, malaria, and hepatitis B and C. Healthcare statistics in Pakistan clearly illustrate the challenges, slow progress, and vulnerabilities of the population. Under 5-year-old mortality rate of 86 per 1,000 live births versus 7 for the USA. Maternal mortality ratio of 170 per 100,000 live births versus 28 for the USA. Total expenditure on healthcare as a percentage of GDP at 2.8% compared to 17.1% for the USA. Disjointed healthcare policy and investments from the government and private sectors have largely focused on the urban population centers of the country, whilst the rural areas continue to be neglected. Thousands of children and elderly die from minor treatable diseases. Children are also greatly impacted by malnutrition and the lack of a hygienic environment. Lack of access to a qualified primary health care network. Poor social determinants of healthcare quality and access such as illiteracy, unemployment, gender inequality, social exclusion, rapid urbanization, and environmental degradation. Lack of access to clean water forces many people to drink contaminated water from lakes and ponds, water often shared between animals and humans. This unsafe practice leads to multiple waterborne diseases such as cholera, typhoid, and acute gastroenteritis. Access for treatment is also hindered by the remote and long distances of travel required to transport patients from rural to urban areas. Even urban hospitals adjacent to rural areas lack the basic life support equipment. The problem is even more acute for women, who are the most neglected and underrepresented in rural communities. Nearly 11,000 women and girls die annually while giving birth, signifying one of the highest maternal mortality rates in the region. From 2008 through 2009, only 28% of births were attended by a doctor, and an overwhelming 65% of women delivered their children at home. Lack of urgent care facilities to treat minor emergencies, such as cuts and lacerations. Compounding the challenges is the existence of quacks, unqualified and unskilled personnel delivering healthcare services. The problem of quackery is prevalent in the rural areas of Pakistan. Due to this, diagnosis is delayed or often misdiagnosed, leading to morbidity and mortality.
आपने क्या पढ़ा क्या है?
सर मैं बीए हूँ. मैं ये चैलेंज कर रहा हूँ कि कोई भी डॉक्टर आए मेरे से सवाल जवाब करे, मैं उसको नहीं दूँ तो वो मेरे को डॉक्टर नहीं बोले, मेरे को जो भी बोलना उसको बोल दे.
Rural populations are so deprived of primary health care that they welcome any and all forms of assistance, private, government, or NGOs. Hamara Clinic was founded in 2013 as a nonprofit organization to help support the healthcare needs of the rural populations. As a nonprofit organization, Hamara Clinic's mission is to provide basic healthcare services to the neglected citizens in the impoverished and rural areas of Pakistan. The word Hamara stands for healthcare and medical aid for rural areas. The journey of Hamara Clinic began with a group of physicians of Pakistani descent whose love for the country and the people of Pakistan inspired them to take necessary measures. Acknowledging the non-existing primary health care services in the rural areas of Pakistan, the physicians felt obligated to take action by establishing Hamara Clinic Healthcare Foundation. The concept was presented at the Dogana Spring Retreat in Houston and was also highlighted at the Upna Fall Convention in Houston in 2013. The group of doctors pooled their resources to open a clinic in Pakistan in partnership with a local NGO. The initial clinic was established in 2014 with the aim to provide essential primary healthcare services in a rural area of interior Sindh. With encouraging results, positive feedback, and a visible impact on the rural community, the physicians started to realize that this model should be expanded to other rural areas across Pakistan. Over the last 3 years, the Hamara Clinic team has been focused on establishing its foundational elements, planning awareness campaigns towards achieving the organization's mission. Campaigns include media awareness in local media outlets and community mediums, This has resulted in increasing interest in the physicians community as well as the general public in the United States and Pakistan. Hamara Clinic team continues to grow, guided by a core foundational board leading the planning and execution strategy of Hamara Clinic's vision. This core team includes personnel with multiple disciplinary skills required to execute organizational objectives, including physicians, technology, marketing, and administrative roles. Key lessons have been learned from the local clinic in operation since 2014. By being on the ground, the team identified areas for improvement. Examples of such include the challenges of locally available physicians and controls around medication dispensing and accountability. By working with local NGOs, Hamara Clinic is more effective in managing and mitigating challenges and risks related to delivering healthcare services to Pakistan's rural communities. The prime example of such operating model is the single Hamara Clinic operating in Rashidabad, Sindh. The clinic is operated in partnership with the Rashid Memorial Welfare Organization, also known as the RMWO. In 2015, the clinic provided services to over 3,600 patients with an allocated budget of $1,500 a month, which includes dispensing free medication and a visit with a primary health care physician at a cost of less than $5 per patient. The partnership with RMO will expand their new site to Quetta, Balochistan, where Hamara Clinic site is being developed as a part of their expansion plans. Expansion into Punjab and KPK provinces are also in works for the RMWO. Similar understanding and discussions in the pipeline include Indus Hospital in Karachi. Indus Hospital provides primarily inpatient care in their communities and foresees the need for outpatient infrastructure to support their inpatient services and capabilities in impoverished and rural areas around Karachi and other Indus locations. The initial dialogue was well received by the respective management board of Indus Hospital and is interested in partnering with Hamara Clinic to expand its outreach. Another anticipated partnership of Hamara Clinic is with the Shifa Foundation, a subsidiary of Shifa International Hospital operating in Islamabad. They have offered to establish 2 to 3 Hamara Clinic locations in the rural areas around Islamabad, which will be supervised and supported by Shifa Foundation. Recently, Hamara Clinic conducted an independent survey across Pakistan to assess the needs of outpatient primary health care. The survey was executed by a group of volunteers across the 4 provinces, resulting in affirming the growing needs for an outpatient primary health care network in the rural and impoverished communities. The survey results are being analyzed by Hamara Clinic's board and will impact the future plans and strategic actions.
Heard about your vision, and I acknowledge that vision and I appreciate that people are in US, and we all appreciate in Pakistan.
I think with Hamara Clinic, we could have a very productive and a very gratifying relationship where we will be able to extend these services and help a lot more people with our cooperative work.
But this reaching out concept by Hamara Clinic, I would say totally innovative, but I would say a very daring and courageous and a dynamic approach. So this joint venture between Rashid Welfare Organization and Hamara Clinic, I should say it's Allah's blessing in our favor that in terms of the operational expenses will be covered up by Hamara, but we will put up the total support, administrative support that comes in at our own cost.
Hamara Clinic needs your support to achieve its vision of delivering primary health care services for those who do not have the access or resources to obtain basic medical health care in the rural areas of Pakistan.
हमारा क्लिनिक थैंक्स।